Hello, greeting from MedAccess. I'm Manoj Kumar, Case Manager for MedAccess India. Today we are with Dr. N.J. Karne, a very famous, renowned orthopedic surgeon in India. Hello, doctor.
Hello.
First of all, will you please let us know what was your reaction when you saw the patient for the first time?
Actually, initially, I was shown only the X-ray of the patient, in which I was told that the patient has got an accident around some 5 months ago, and he was advised amputation or the cutting of the limb at his country there. And when I saw the X-ray, I said, okay, no problem, there is no need to cut the limb, even though I need to see the patient personally, then only we can inform accordingly. When the patient came to us, I was shocked to see the patient, because you must have seen in the picture that patient has loss of complete tissues. The almost whole of the leg, we call it the leg, the area between the knee and the ankle is the leg area. The bone was completely exposed. It was almost 6 inches bone was exposed, and almost 3 inches of the bone was missing. There was no bone in between, there was a big gap in between. Yes. And there was very bad infection. It was so bad infection that there were maggots in the wound when the patient came here. We took the challenge. Our first challenge was getting rid of the maggots. The second challenge was infection in the wound, and which was very difficult. It took, we have to use very high antibiotics for that. Third challenge was realignment of the spray which was put to the patient. Fourth was that gap which was there used to be filled up. And fifth was a huge wound of almost more than 10 inches that needs to be covered up. And the last one is the gaining of the length, because he has lost almost 4 inches of the length, and ultimately the bone healing. Fortunately, at every step, rather we tried to club 2 or 3 surgeries in one surgery, so that the expenditure of the patient can be reduced, because the expenditure would have been very high. We have saved limbs of many patients who were advised amputation outside, and I used to take challenges in those cases, and I had given them the almost best possible result, that is almost as good normal limb as possible. Now these days everybody gives the treatment. What I believe is, what is important is how fast you can give recovery to the patient, how best quality you can give to the patients, and most important, how you can reduce the expenditure of the patients.
Okay, Dr. Karne, thanks for your precious time.
Thank you very much. Thank you.
My name is Mohamed from Sierra Leone, West Africa. I came to India about 3 months ago now for health program concerning my leg, my broken leg that I have due to an accident. First of all, I want to say thanks to God Almighty for bringing us safe to India.
So how has been your experience in India so far?
Well, I've had a lot of experience as for now. I'm trying to learn Hindi. Of course, greatly. My social med access.
Okay. Okay, so MedAccess helped you in getting the treatment?
Yes, they help show to the hospital, the right doctor. So I want to say big thanks to them for that.
Okay, so Mohammed, how are you feeling now? Is it better?
Much better than before. Not much better.
Okay, so Mohammed, I have got a news that you have started walking. That's a great news.
Yes.
And I wish you a very speedy recovery, and I hope that you get well soon and you start playing basketball as you did earlier.
Thank you, sir.
Okay, God bless you, Mohammed.
Thank you, sir.
Good morning. I'm Shashi. Would like to share some insights about Mohammed's case that we managed here in India. To begin with, Mohammed's case was pretty complex and is one of the most challenging cases that MedAccess has managed so far. The prognosis was bad and the case was complex. But somehow we decided to take up the case and take it as a challenge. When Mohammed came down to India, we sought multiple opinions from the best of the best doctors that we work with, And finally, we selected Dr. Karni. Dr. Karni is a renowned orthopedic surgeon, and he's best known to manage orthopedic trauma cases. Then, the second challenge we had was the cost constraints. The parents had some financial issues, and there was a limited budget. Therefore, we had to manage the whole case, which was so complex, and we never knew how long the patient is going to stay, what complications we are going to face during the process. But somehow I'm happy to say that we could manage the complete case within the budget. Then through our medical case management approach, we coordinated and monitored the whole case, which led to the best possible outcome which can ever be imagined for such a complex case. It was a young boy with his mother, and case being so complex, MedAccess was always there as a family away from home for them. So keeping in mind, all these factors, I feel that MedAccess has done an excellent job. It is a proud feeling today that Mohammed is walking, smiling, family is happy, and so is MedAccess. Thank you.